Welcome to Introduction to First Aid Part 2. Okay, let's talk about what do we do during an emergency or during when we meet a casualty. We will perform three things: primary survey, secondary survey, and recovery survey. Survey. This is not the survey that you do when people ask you questions and then you give answers. No, there is this acronym DRSABC. D stands for check for danger. R stands for check for responsiveness. So what does it mean? When you meet a casualty, someone who is injured, you check for danger around you. Is there an oncoming car? Okay, is if the person is suffering from heat stroke, is the environment too warm for you to perform first aid? Should you be taking him to a cooler area? So that's what you do. The D stands for check for danger. R stands for check for responsiveness. You have to call the person to see whether the person is conscious or unconscious. Next, S, shout for help. If the person is unconscious and not breathing, you have to quickly get someone to call 995 and then another person to get AED. Next, A. A stands for open airway, which is the mouth. I will teach you further when we do CPR, but what happens is open airway means keep the airway clear. So you will have to tilt the chin, okay? So, and this when you tilt the chin, the airway will be open and therefore the person can breathe better. Then B stands for check for breathing. It's very important. You need to know whether the person is breathing. If the person isn't, then C, command CPR. Of treatment. Now, we always do life-threatening emergencies first. Okay, like for example, lots of bleeding or someone is not breathing. Then after that, we'll treat bleeding wounds, not the severe kind or fractures. Okay, then lastly, minor injuries like paper cuts or a bruise. There are different levels of responsiveness. We go by the acronym AVPU. A stands for alert. Is the person alert? When you're asking question, is he able to answer simple questions? And are his eyes open? And voice, is he able to respond to your voice by answering questions? Simple questions like, what's your name? Where is the pain? Is the casualty able to answer your question? So that's what you do. You check for whether the person is alert and whether the person can respond to your voice. And pain, is the person able to respond to pain? So if you see a bruise or if there is bleeding and you try to stop the bleeding by putting your hand there, does the person move or squeal when you touch the part that should be painful? Okay, but I'm not saying that you will go and squeeze the bruise that's painful to check whether the person is unconscious, because this one is actually just for us to confirm that the person is totally unconscious and not able to respond to pain. It is actually a very serious level of unresponsiveness, so we need to be careful. And U stands for unresponsive. That means the person is totally no response, no movement, can't answer your questions, can't move at all, cannot respond to pain. Okay, after you have done the primary survey, that means the checking using AVPU, now you do a more detailed examination of the casualty to look for other injuries or conditions that may not be obvious, meaning fractures. Okay, so then you see that person. Usually we will touch the head a little bit, the neck, and then the sides of the body to the side of the legs to see whether there are any broken bones or any bruises. Survey, we go by the acronym CHECK, CHECK. C stands for check for pain and or discomfort. H, history. If the person is conscious, ask questions. What happened just now? Do you suffer from diabetes? If you notice a lot of bruises or bleeding. And E, examine head to toe for any missed injuries, which is what I was talking about just now. You will like touch the head gently, the neck, the shoulders, the sides of the body to the legs to see whether did you miss out on any bleeding spots or any fractures. C, compare opposite side for abnormality, which means that you are actually checking if the left leg when it straightened looks like this, the right leg does it look slightly crooked? So you check. And K, keep monitoring vital signs. That means you keep, if you can, you check for the pulse, okay, and you also check for breathing. Person is unconscious, but you don't see any visible injuries, and he is breathing. That means you don't have to do CPR. You place him or her in a recovery position, just like this. I will do a video. I will show you a video the next time how to put the person in a recovery position. 1. Kneel beside the casualty and remove any accessories or bulky objects. Yes, very important. If he has a sharp key in his pocket, he may get hurt if you move him to the side. So we will remove any sharp objects. And then you position the casualty with body lying face up. Victim towards yourself. You are the rescuer or the first aider. The final recovery position, and as you can see, he will have the one palm facing up, and then the other hand is supporting his own head. Okay, and then you need to monitor vital signs every 2 minutes, because he may stop breathing 2 minutes later. So check for breathing, check for level of consciousness. If the person is the person waking up, is the person able to respond to voice? Did he open his eye? Is he opening his eyes? Of part 2. There will be a part 3 later.